Bariatric surgery is known first and foremost as a weight loss method for those with obesity, but in reality, it's about far more than dropping pounds. This is a procedure to improve quality of life and even extend life for those in unhealthy situations. When you do the surgery, what's actually done?
That's a set of procedures that we do to change the GI system or the GI tract on the inside in order to induce weight loss. But not just weight loss, the goal is to alter and change metabolism. It's usually a one-night stay in the hospital, and we use small incisions for the surgeries that we do. We're either making the stomach smaller, and so, for example, with the most common procedure like the sleeve gastrectomy, we remove about 75 to 80% of the stomach. The other procedures like a gastric bypass, not only do we make the stomach smaller, but we don't remove the stomach, but we exclude the majority of the stomach. And so we create a small pouch the size of an egg. And so we will divide the small intestine at one point and connect it to that pouch. And so we are essentially bypassing or skipping the majority of the stomach and some of the small intestine. That's a way to not only restrict the amount of food one can eat, but also alter how much you can absorb from what you eat. When we alter the GI system, we're also altering hormones in the body that control and regulate appetite. After surgery, there is, in a sense, a reset to those hormones that we found in research studies. It's more than, hey, eat less, work out more. This is biology we're talking about. And so you need a strong tool. Surgery is the strongest tool that we have for weight loss. Some early complications that you could have are just kind of routine nausea, vomiting, dehydration that might send you to the emergency department requiring some extra IV fluids. Bleeding and infection are possible complications you can experience, and those are even fairly rare for some individuals, and they are having to relearn their relationship with food and change how they deal with stress and various triggers that might cause overeating. There's a psychological component, meeting with a dietitian. I think people who already have good tools in place, they are the ones that do better after surgery. Patients who have gone through the rigor of the program, all the appointments and all the counseling sessions, and we have informed them very well before surgery. I mean, they are so ready for this change and so committed. The risk and the change of surgery and the lifestyle changes required after are worth it